Okay, so this is the last part of the sexual self. All right, so this is the continuation of the different or the common sexually transmitted diseases or infection. So we are now in the fourth one, chancroid. Okay, so these are bacterial infection that causes open sores on or around the genitals of men and women. Okay, so it is caused by bacterium, which is known as the Haemophilus ducreyi. Okay. Next, we have the HPV or human papillomavirus. So, this kind of sexually transmitted infection can cause genital warts and even cancer. Okay. And if the person has this kind of infection, you will notice bumps or even cluster of bumps or protrusion in the genital area. Okay. We have herpes simplex virus or the HSV. So this one could affect the genital organ or the mouth. So as for the classification, we have the HSV1 and then HSV2. Okay, so for HSV1, this is known as the oral herpes. Okay, so it causes cold sores and fever blisters around the mouth and on the face. So obviously it might be caused by oral engagement or oral sexual engagement with someone who is infected with HSV. Okay, so you might think that these are normal mouth sores. Okay, and but then it will appear as many as it can, and it could even affect the throat of the person. So it's really a good thing that you might need to consult an OB-GYN, okay, and a doctor, okay, who can prescribe medication, maybe antibiotics for this kinds of infections. And for the genital herpes, this is known as the HSV2. Okay, so this is responsible for the genital herpes outbreak. And then we have the Trichomonas vaginalis. So obviously this is for females, okay? And this is caused by protozoal infection associated with adverse health outcomes such as preterm birth and symptomatic vaginatis, okay? So what are the symptoms of Trichomonas vaginalis? All right. There might be abnormal vaginal discharge, so it could be of different color. It has a strong smell, okay? It might be brownish or let's say yellowish or greenish, okay? Vaginal spotting or bleeding, okay? Genital burning or itching, genital redness or swelling, and frequent urge to urinate. There is also pain during urination and sexual intercourse. So these are the different STDs or STIs. Okay? Thank you. And if you have any questions, you can send me an email in psicologista.files@gmail.com, or you can reach me here by posting down your comment. Okay. Thank you.